Everyone has a BBP.
Now that's a big overstatement, but it is how you should view everyone when dealing with blood and body fluids. Standard or universal precautions require you to consider every person a possible carrier of a blood-borne pathogen, and to treat his or her blood or body fluids as if they were infected.
Fast fact number 7. Bleeding emergency.
When assisting someone who is bleeding, follow these precautions. First, send someone to call for emergency personnel if necessary. Next, protect yourself. Your instinct may be to rush to the injured person, but taking a few extra seconds to put on gloves can prevent infection.
Gloves? Nobody's got time to be putting on gloves when someone's bleeding.
You should always use disposable latex or vinyl gloves when dealing with blood. Always. But remember, gloves can tear or be punctured. Make sure to cover cuts or skin abrasions on your hands with bandages before putting on gloves. Never reuse disposable gloves or use gloves that are damaged. If you are allergic to latex, check with your supervisor about alternate types of gloves available. Nowadays, they even come in a pretty designer purple.
Fast fact number 8. Glove removal. And now, a review of the fine art of proper glove removal. When removing gloves, follow this procedure. Carefully peel one glove from the top of the wrist to the fingertips. Then, hold it in the gloved hand. With the exposed hand, peel the second glove off, tucking the first glove inside the second. Dispose of the used gloves promptly, and never touch the outside of a glove with your bare skin. After removing the gloves, wash your hands as soon as possible with non-abrasive soap and water. Rinse completely and dry with a clean towel. The use of an alcohol-based hand sanitizer is also acceptable. But you should still wash your hands as soon as possible.
While removing gloves may seem mindless and simple, it is very important to do so correctly to prevent accidental exposure.
Fast fact number 9. Resuscitation.
If you need to give mouth-to-mouth resuscitation, protect yourself by using a mechanical respirator or a pocket mask.
Fast fact number 10. Wardrobe malfunctions.
At any time, if any of your protective equipment is penetrated by blood, remove the item and replace it immediately.
Fast fact number 11. Cleanup.
If it's your job to clean up blood or body fluids, follow these precautions. 1. Always wear gloves to protect your hands from contact with blood and other infectious material. 2. If there are large amounts of blood, wear a smock to protect your clothing. 3. Whenever possible, use disposable materials such as paper towels to absorb blood. And 4. Dispose of all materials according to your school's policy.
Fast fact number 12. No hands.
When cleaning up contaminated sharp objects such as glass, use a broom and a dustpan. Never use your hands.
Fast fact number 13. Garbage removal.
If you empty garbage cans or laundry bins, always pick up and carry bags by the top. Never hold them against your body or place a hand underneath to support them. Sharp objects can penetrate bags and cut you.
Fast fact number 14. Potential exposure.
If you think you've been exposed to HIV, HBV, or HCV, do not panic. Most exposures do not result in disease transmission. Clean up and immediately, or as soon as possible, report the incident to your supervisor. This way, any post-exposure treatment can begin right away. Your employer will advise you about testing, counseling, and any follow-up steps. Remember, being exposed to an infectious material does not mean you are automatically infected.
All this hoopla over BBPs and blood and body fluids? Who can remember all this stuff? It's not that big of a deal. Why should I even bother?
Because BBPs can kill you. It is that big of a deal, and you should bother. BBPs, at their very least, can make yours or someone else's life miserable. And at their worst, they can become a matter of life and death.
And now, some quick tips.
And finally, here are some other quick tips to remember concerning BBPs. Keep soiled hands away from your eyes, nose, and mouth. Always wash your hands before eating, drinking, smoking, handling contact lenses, or applying cosmetics or lip balm. If blood or body fluids enter your eyes, nose, or mouth, flush the area with running water as soon as possible. Wear gloves whenever you may be exposed to bloodborne pathogens. When assisting someone who is bleeding, try to get the person to stop the bleeding by using direct pressure. Don't clean up potential BBPs if you're not trained or authorized to do so. So there you have it, the fast facts about bloodborne pathogens. Not too painful, huh? $5.6 million. It's a sad reality in our schools today that you have to be cautious and aware of bloodborne pathogens and the diseases they can cause. Yet it is a reality. By following these guidelines you've seen here today, you can keep yourself safe and healthy.